Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hana
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin. Healing Through Dentistry today from the car, straight from Boston. So we had an overnight flight. So we're just
fresh. And so we'd like to share some more Healing Through Dentistry stories with you and our insights from the weekend, because it was again amazing and full of information and new knowledge and connections.
So today's live also on Instagram will be in English. So Czech people, please come and practice English.
So what was your takeaway, Eva, from this weekend? Or a reminder, because there are a lot of reminders.
The main message is regenerative medicine. We're integrating the medicine back into dentistry, which is the main thing. And I think it's a huge thing. It's a transformation of dentistry. This is what we do. Why we do what we do, because my main goal is to recover clients' health.
Yeah, and why? We should always start with why. So for Eva and me, it might be more easy to understand because we are aware of, anatomy and histology and
embryology,
immunology, biochemistry, and everything is connected. But it is true that it has become a little bit forgotten from the majority of the dental industry that all parts are connected. So I would probably like to, now you mentioned embryology, I would like to maybe start there, because if you imagine that teeth are the same embryological origin as skin and a nervous system, then you would be like, oh, I can't take teeth just like, oh, that's nothing. We're just like fillet. We just, take out tooth and we do nothing. So it is, for me, what Dr. or Professor Ganati said and landed on me so deeply. He said that the tooth surgery is as important as heart surgery, which, I am aware of it. But like when he said it, it was like, wow.
Yeah. Same as brain surgery, because the most important thing you would like to do when you are looking after clients is to heal the bone. And fascinating is that we are not aware of how much hidden and silent inflammation there is in our jaws, upper jaw, lower jaw. And it comes from traumas. It comes from undeveloped wisdom teeth. It comes from dead teeth, which are root canal treated. This is where the modern dentistry wanted to save the tooth for functionality. However, we're seeing what a harm for the overall health.
And mainly from after extractions, like most of you guys might have experienced wisdom teeth extractions. And we also learn, and this is, I think, Professor Ganati's purpose and mission, like this lifetime, just to show us and put in the data how important is actually look after the bone underneath the tooth. So it's not actually about removing the tooth. Of course, we remove the tooth, but that's the point where the surgery starts. You really need to look after the bone very well, because of course, or for me is of course, the infection, the bacteria, which is just so visible. We saw a lot of data this weekend as well from DNA and from pathology, how much of a diseased stuff is in our bone. And it doesn't have to be a massive lesion. You can obviously see on your panogram. It can be a little lesion, but how much it affects actually the rest of the body, because it is in the bone. And when the bone is not cleaned properly and looked after properly, it stays there. The body is smart, so it covers it all up. Put it in a little whatever cover. We call it actually CSRs, closed
Covered socket residuals, so residuals which are colonized by bacteria,
closed
viruses, and pathogens.
closed socket residues, yes, and it influences the whole body. So depending where it is in the body, so let's say it's incisors, it will affect your kidneys, or it may affect your kidneys, it may affect your gallbladder,
Your urinary system,
your urinary system, your spine, part of the spine, everything. So everything what is on the path.
also your emotions and your thinking and how you feel, what the energetic level is, whether you have a brain fog or not, whether you have skin condition. It's so profound. And I would say one thing which is very overlooked by the dental society is that we mainly see hypodense lesions, meaning this is round area around the apex of the tooth, which we understand as inflammation, but there is another situation where the bone is very sclerotic, very dense, and that bone, it's ischemic necrotic area, which is very dense. And this is what the dental world is not recognizing as a trigger for immunity, as inflammation. And what the pathology says, if you send a sample, and I'm so grateful we are part of the community of dentists who are sending these samples to DNA connections in states. And there are a huge number of dentists who are doing that to collect the data. And the data is fascinating. There is actinomyces. There is bacteria which are highly infectious, and they are very much triggering the immune system. So no wonder that we all are diseased.
Yeah, you mentioned skin problems and eczema. Again, I'm coming back to the embryology. So if the tooth comes from ectoderm, which is the outer layer of the embryo, and the skin comes from the ectoderm, so there's no wonder why a lot of people we see have eczema, skin conditions, migraines.
We see it disappearing. So
And-
that's the thing.
and-
After you remove the infection.
Yeah, the beauty is when we remove the inflammation, the silent inflammation, we clean the bone, we look after the bone very well, then it disappears. Sometimes it disappears quite quickly. Sometimes it takes some time, few months to disappear from the body. Because again, like if you imagine that something's in your body for 5, 10, 15 years, you cannot assume that it's going to be gone right after the surgery.
Sometimes is, right?
Sometimes it is like we see a lot of results, and it differs.
The other part is the nervous system. So you said it's connected to skin. The ectoderm is also the nerve system. So that's why we see so much neurological issues clients have, chronic issues, fatigue,
Chronic
energy levels, pain,
Depressions, anxiety, all levels of, nervous system breakdowns.
Yeah. As a matter of fact, I would like to share one client story who was presented in Boston, which was a young guy who had 4 wisdom teeth removed in 2008. So let's say 8 years ago. And he came across to all sorts of doctors because he had chronic fatigue. He said the main thing was the energetic levels. He couldn't sleep. He was like very much aware of sleeping patterns, but he couldn't reach any goal. He was very tired, fatigued, no energy. So he came across to biological dentistry, and he has approached our colleague who is in the group of Boston. And I'm so grateful for all the group and, co-elevation and cooperation. And he had presented to him, he had done 3D images, he had done physiogenics, which is advanced biomapping to see the extent of infectious
Or silent inflammation in the bone.
areas in the bone. And then they have planned a treatment plan, say they removed the areas, infected areas, but you only find out whether these conditions with the special diagnostic like 3D image and physiogenics. So they planned the treatment. They removed the covered socket residue, sent it to pathology, sent it to DNA testing. And he was so surprised. There was a testimonial, his energetic level after one side was impressive. But once he finished the second side, the left side, he just changed his life. He was so grateful for the surgery, for the result he had received. And you see, this is when you have your wisdom teeth removed and you're not ready for that. So this is why we pay attention to prepare clients for any surgery. And we're talking about dental surgery, but we guys are overtaking or taking other surgeries in life.
It can be a knee surgery. It can actually be a heart surgery. It can be any surgery.
Yeah.
So we should be thinking of preparing for the surgery.
We're on a mission to educate clients, educate people, educate the world.
Educate ourselves, really.
Educate ourselves.
We learn every day. But if you were talking, I just want to jump in because you were talking about the energy levels and you were describing this client. We see it in our surgeries as well. But what is important, we experience it on ourselves. So I'm just saying we learn ourselves as well because we did have CSRs on each quadrant as well. And we both haven't had any extractions. So this is quite interesting for people who are like, oh, I am okay. I don't have any wisdom teeth. I'm fine. But that's not true. We thought so too. But
the residuals are developed because you have the gem, the tissue, which should be developing into the tooth, but it hasn't. And that's why there is this residue, which is colonized later on with pathogens. So Hana and me, I think it was like
a year
almost
and a half, 2 years ago.
Almost 2 years ago. We had
but
surgery done.
remember how I kept telling you, oh my goodness, I've got so much energy. She was just stopping me because I was like, let's plan the business, let's plan new ideas, let's just put them in
But it was with Hana, it was over the night really, right?
Right.
So you said you feel like in a first grade, when
I know, I felt like I was,
years old.
No, I said I was 12. I don't know why I remember 12 years old. You probably remember when you were small kid, you wake up and you're full energy. What can I do? What can I do? Let's do stuff.
Yeah.
And that's what we're losing over the time. And we think it's normal, but it's not normal. We should all wake up full of energy, full of, lust to alive and be energetic. And so a lot of people do not know that they do have silent inflammation in their jaws, which may be actually draining them, slowing them down.
I would like to say for me, the surgery was like somebody was lifting a lid from my heart and a little bit of bubbling effect in my intestines. And that's interesting or fascinating. This is what it is, that these wisdom teeth are on a meridian of your heart and small intestine. But if I didn't know, you feel your body. So I'm not thinking on a dental chair, look, it should be something there and there. It was profound.
I remember you said you were able to breathe easily and hear easily, which you didn't realize you had an issue with, right? So you don't know what you don't know until you experience it's better. We've got I've had a client who was oh, I can sleep on my left side. And I was what do you mean? He was before I had the root canal treated tooth there and in infection before you removed it. Well, I know that I was just trying to fall asleep on my left side, but then I turned on the other side because when I am explaining it, when the area just got warmer and more hot, it just triggered him and he did have to actually turn around.
Inflammation
and he only realized after we removed the tooth that was the case. So yeah, everything is connected. It is very important not to have your tooth removed, but to have to clean the bone, the dead tissue around the apex of the tooth, or around the tooth, as a matter of the fact. And then
sometimes it's a huge area.
Sometimes
then you need technique to recover that area as well. So this is the part of the lectures of Professor Ganati. I wish all the dentists would take this education. He is on a mission to change education system, and I love that. For the mankind, it's really transformation
because
for
regenerative dentistry. This is the real biology and biological dentistry, because you are looking after the dead tissues and you're reconnecting the body to,
whole body.
So that's for me the real biology, because you're regenerating the meridian energy path.
In other words, if you have ischemic necrotic areas, there are blocks on the pathway of energy. All the cells, they are electricity, they are energy. And if you have a block there, there is no pathway, no communication. So you really, by cleaning well the area, reconnecting the body to whole body, you're healing.
Yeah, that's quite nice what you've just said. I'm just going to add on it because that's why we use protein, right? Also, because you said where there's a blockage or a scar. So it's a scar tissue. So it's like when you cut yourself, you've got the scar, or after operation, let's say I've had appendicitis when I was little and I've got a scar there. And when there's a scar for a body, it's a trauma. It like cuts the energy. It's the disconnection, and then the energy cannot flow freely anymore. So, and that's same with issues in the mouth. Like if you do have a sclerotic bone there, or osteomyelitis, or like fatty degeneration, basically not a healthy bone.
Root canal treated tooth, or dead tooth.
Then it just gets into depolarization. So like the energy is blocked. And so we see, and you may be actually sharing your last week client, because that is fascinating. Because when we place Procaine, the Procaine is a local anesthetic, which which gets the polarization okay. And people do feel relief right away, like right away.
Yes.
So what happened to your client Eva last week?
It's a technique we call neurotherapy, which is what you have just described. We are targeting the areas which is ischemic, which is dead, and we are testing how would client feel when the blockage is gone. So you have kind of a taste what that could be.
Yeah, it's not 100% because obviously that'll be easy and then you can every day come over and we'll deal with it. But it just tells you a lot.
Tells you a lot.
And so what happened to your client?
A client coming in on Tuesday morning for initial assessment, and it was a lady, and she was very worried about that she is not getting sensations into her hands. Well, she also said that she had like maps in her mouth, and it's very sensitive past months. Happy that you might not be use your hands. Then your career is over, right? So she had sensation, tingling sensation, and not sensitivity in her hands. One may say that, this is part of the profession. However, what we have found out is that this lady, when she was pregnant, so in her pregnancy, she had her wisdom tooth removed, and it was almost 20 years ago. When we have seen the X-ray, it showed clearly the area at the wisdom teeth area, which was empty. It was a residue. So this is what the pathology can test it later on, that there is a huge infection, pathogens. And when we have placed the Procaine test, it was fascinating to see how the client, she was describing, I can't believe this, the warmth into the hand is coming back, what you have done, right? Also, she had felt back pain. So the back pain over the day got better, not immediately. So she was texting me later on, what did you do? This was like transformative. And again, we were like, let's say, starting with a treatment plan. The first thing what we are planning is to remove amalgam fillings, because that's another interference which is contributing to a different microbiome in her mouth, which might be connected with the pain of her buccal mucosa or of her inside of the mouth tissue. So we will start there, and then we will approach one of the dead tooths and CSR, which is covered socket residuum after the wisdom tooth was removed. And I can't wait for her results, basically.
Yeah, she needs to get ready first about with the nutritional protocol, supplementation protocol. We need to see her T levels, lipid profile.
When people are seeing a little hope, they jump on a fast train and they deal with that, which in her case was that she went for a blood draw to see what her D level is and lipid profile is. And we will start from there. So let's see what numbers we see, and then we will just recommend nutrition and supplementation protocol. And I think in 3 months, she is ready for all the treatment to be done.
Yeah. So anyone thinking that they have had wisdom tooth removed or any tooth removed, or they didn't have wisdom teeth in the first place, like 2 of us, or they do have a root canal, or they have amalgams, consider seeing one of us or one of our colleagues in the group and let them do the 3D scan, physiogenics, which is biomapping, and
Blood test.
start your healing journey, because
Take your responsibility into your hands, because it comes on mindset. I would say this is the key, mindset first. So if you're aware of any condition, you might like to take an action on it.
Yeah. And if someone tells you everything is okay and you don't feel okay, then just dig deeper. Just go and see someone else and just try to see it from different angle, because, it's your health. And if there's something wrong with you and if you don't feel like you're the superman, superwoman, then let's work on it. Okay. Well, take care. We are coming back.
We enjoyed this session after 12-hour flight.
Yeah, we were delayed again. So I don't know what does that mean.
I love coming back, and I can't wait for next month, because we're going to Frankfurt, to Germany. So our side of the world, to do more education. And I feel that the education never stops.
No, it never stops. We just sign up for level 2. So take care and sending lots of love.
Thank you for joining us on Healing Through Dentistry podcast. We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care,
and we will see you in the next episode.